I'm Dr. Van Afstel.
Oh, hi. Hi, I'm Jenna's dad, Chris.
Nice to meet you, Chris. I'm the pediatrician that's going to be taking care of Jenna.
Okay.
So I just wanted to ask you some questions. So what's bringing you guys in today?
We've been through it the last couple of days. I mean, Jenna she's had the runs. I've never seen anything like that before. Just going, seems like all day, all night for the past, 3-4 days, something like that.
Wow.
Yeah, it's been really rough.
She must be pretty miserable, and probably you guys too.
Yeah. I mean, she's just kind of not acting herself. I mean, she's usually running faster than all the other kids, and she's just been kind of laying in bed, not really wanting to do much.
Okay. Tell me about how it started.
Well, I think it was about 3-4 days ago that it started. She just was going to the bathroom all the time. It was just really kind of watery runs.
Mm-hmm. And then what happened?
Well, I mean, it seemed like it was okay. We kept thinking, okay, it's going to go away. And it just, it just didn't. And then it seemed like late last night, started noticing maybe a little bit of blood in the bowl when she would go. And then, I got home from work today and it was still going on. I said, okay, let's just bring her in. So I didn't even change her or anything. She came right in.
Oh, okay. Yeah, that's a good thing you brought her in. You
Yeah.
did the right thing.
Okay.
Can you think of anything unusual or different that you did, in the days or even weeks before this?
I mean, it started around Monday and we went to this barbecue over the weekend. I guess her other siblings thought maybe they had the runs for a little bit, but theirs lasted like a day or two and went away, so maybe there was something going on there. Other than that, it just been normal, going shuttling the kids around to practice and all that fun stuff.
Okay. Was there anything unusual that you guys ate at that barbecue?
No, I mean normal barbecue stuff. I think most of us had like brats or burgers or something.
Okay. Anything that was left out for a long period of time?
I mean, it wasn't our house, so I don't know how long the stuff was sitting out there. I mean, I'm trying to remember what Jenna had. I think she had a burger that day. She really likes them usually.
Okay. And then what happened? Anything else?
No, I mean, like I said, it's just been the runs for the past couple of days. We've been trying to keep a close eye on her and, just telling us her tummy hurts at times. But, she's been drinking, though, too. We've really tried to push, we heard that Pedialight's good, so we've been trying to push that.
Great.
And stuff.
Mm-hmm. And how's she doing with it?
She doesn't want to drink it, but we try to make a game out of it, and she does pretty well with it. So.
Okay. Have you noticed anything about her hydration? So things that you might notice would be like urination, how that looks, or how often she's going?
I think she's going, but she's going to the bathroom so much, number 2, that it's hard to tell.
Yeah. Okay. Yeah, that would be challenging. Earlier you mentioned that she said her tummy hurt. I know she's only 3, but is she able to describe to you what that's like?
Not really. Sometimes she kind of curls up a little bit and says her tummy hurts, and sometimes it goes away on its own. Sometimes we rub her back a little bit and she feels better.
Okay. Is she able to tell you any particular spot in her belly?
Not really.
Not really. Okay. And is there anything that seems to make it better or worse?
Not really. I mean, I think, like I said, it seems to kind of go away sometimes on its own. I don't know, maybe it's just us giving her attention helps too.
Okay.
Yeah, I mean, we tried Tylenol, but I don't think that did anything.
Okay. And then, how about, has she had a fever at all?
She felt warm yesterday, but to tell you the truth, our thermometer hasn't been working for a little while, and we haven't replaced it, so I couldn't tell you.
Okay. Has she ever had anything like this before?
No, she's our healthy one. She's a tough one in the family.
Okay. And her bowel movements, prior to this episode, what were they like?
I would say normal. I mean, we never paid any attention to it, to tell you the truth. I mean, she was potty trained at like 2 or 2.5 or so. She was kind of ahead of her brother and sister on that realm. So, yeah, I mean, she does well, it seems like.
Okay, good. You mentioned that she's the healthy one out of your kids. Do you have other kids?
Yeah, so 2 others. She's got an older brother and an older sister.
Okay, are they healthy?
Yeah, I mean, they, have colds and things like that from time to time. One of them doctor thinks maybe has, AED, but I'm not sure.
Okay. Anything else that runs in your family?
Not that I know of. I mean, my blood pressure's been a little on the high side, but other than that, doctor says I need to lose some weight, but other than that, it's not much else.
Okay. Anyone in particular that you know has any trouble with their bowels or intestines or issues?
I don't think so, no.
Okay. And you may or may not have heard of this, but anyone who's had something called inflammatory bowel disease, Crohn's, ulcerative colitis, doesn't
No, I
ring any
mean,
bells?
you'd have to ask my wife for sure about her family, but
Okay.
not in mine that I know of.
Okay. And then just some other kind of routine questions. So you mentioned that you have 2 kids. Anyone else who lives at home with you guys?
No, that's all.
Any pets?
Not anymore. Her little goldfish did not make it too long,
Oh.
but yeah.
Yeah, that's too bad. How about any travel recently?
No, we kind of hung out here this summer, so nothing. Haven't gone anywhere for probably 6 months or so.
Okay. Is Jenna in daycare, or what does she do on a usual day? What's a typical day for her?
Yeah, I mean, she goes to daycare during the week, and that's pretty much, either my wife or I pick her up afterwards and hangs out at home.
Okay. Anyone that you're aware of who's sick at the daycare?
No, but they usually are the last people to tell us these things anyway, so
Okay.
not that I've heard of.
All right. Anyone who smokes in the house?
Oh, no.
No. Or smokes in general?
No.
Nope, no smokers. Okay. Does Jenna take any medicines for anything?
No, I mean, every now and then we'll give her a gummy vitamin, but that's about it.
Yeah. Okay. Let's see. And then you mentioned that she's otherwise pretty healthy, but I just want to make sure I asked about all of that. Tell me about when she was born. Maybe she was...
No, she went home with my wife and 1 or 2 days after, and no issues. She did well.
Was she born more or less around her due date within a couple weeks, or?
Yeah, I think so.
Yeah. Okay. Has she ever had any surgeries?
No surgeries.
Never
And
had
this
to
is the
be-
first time we've even been in the hospital with her, so
Yeah.
yeah.
Must be kind of scary for you guys.
Yeah. I mean, obviously, it's been a rough couple of days, so we're just glad that she's here to get checked out.
Yeah. Good. We're glad she's here too. And then anything else you can think of in her medical history?
No. I mean, she's been, like I said, she's been our healthy one. It seems like the other ones have had more colds or problems that we've had to bring to the ER for, but she's been the healthy one.
Okay, good. And I'm sorry, but just a few more questions about her. You mentioned that she was born on time. As far as you know, did she develop fine? Did she meet all her kind of milestones, we say, which means like, did she sit on time? Did she walk on time?
Yeah. I mean, I do remember talking about it with her pediatrician, when we come for the visits, and they seem to have no concerns. It seems like she's been doing well. What I can remember from her siblings, it seems like she's even ahead of the game with compared to them.
Good. Do you remember roughly what age she was when she walked?
Probably somewhere around a year.
Okay.
Yeah.
And then how about when she first started talking?
Yeah, probably about the same, somewhere around a year, and then she was talking a mile a minute after that. She had to keep up with her big sister.
Okay, good. And would you say now, as a 3-year-old, that most people can understand the majority of what she says?
Yeah, I think so.
Okay, good. Do you happen to know if she's able, is she starting to scribble yet? Can she draw any shapes?
Yeah, I mean, it's, they work on that in daycare, and she can scribble pretty well. She can even do a couple letters. I mean, really easy ones, but yeah.
Good, that's great. Okay. I think that's most of the questions that I have. Do you have any questions for me?
No, I mean, just what do you guys think's going on with her, and what can we do to help her?
Yeah, so I think I'm going to take some time to examine her and try and see what we can figure out from that, and then we'll touch base again and let you know what we think could be going on.
Great. Thank you.
Yeah.
Thank you.
You're welcome.
Come in.
Chris only has a half hour, right? Oh, God.
Hi. Hi, I'm Dr. Van Astel.
Oh, hi. Thank you. Thanks.
I'm going to be taking care of Jenna today.
Sorry. Normally you say your name. Like, hi, I'm Dr. Russell. Thank you.
Alright, we're really going to do this. Okay.
Yeah, we are.
Who's her pediatrician?
It's Dr. Cuppy.
Okay. Alright, and then can you tell me about her development?